Hi, and welcome to the Fortify Your Brain Summit. I'm Betsy Schroeder, your host, and today I have as my guest Dr. Alex Dimitriu. And Dr. Dimitriu is a psychiatrist and a founder of Menlo Psychiatry and Sleep Medicine. He is the product of an engineer and a pianist, and the balance of art and science has shaped his career as a psychiatrist. He brings a deep respect for science, philosophy, and spirituality into his work. Professionally, Alex has dual board certification in psychiatry and sleep medicine. He has previously worked as a consultation psychiatrist specializing in the complex interplay between the mind and body. Welcome, Dr. Dimitriu.
Great to be here, Betsy. Thank you so much for having me. And this is a field that I really love, and I think there's so few doctors that practice psychiatry and sleep. My hope is just to kind of get the awareness out there and have more people aware of the intricate interplay between how we think and how we sleep at night.
Yes, absolutely. Thank you so much. So can you start by just sharing a little bit more about your background and then what you do there at Menlo Park Psychiatry and Sleep Medicine?
Sure. So I initially was training in neurology. I switched from neurology into psychiatry because for me, the human brain was always like the most fascinating thing that controls all of our experience in our daily lives. So I switched into a psychiatry residency, trained in New York, there was always a part of me, my dad's an engineer, I kind of loved the math and the science behind things as well. And the brain is just like, there's just not much we can measure objectively, except for sleep. And that's what attracted me into sleep, because in sleep medicine, we actually can do sleep studies. We can analyze sleep architecture, look at the phases of sleep during the night, and kind of put a number to things. So for me, it seemed like a natural progression to go into sleep medicine. I completed a fellowship at Stanford in sleep medicine and kind of took that knowledge back into my practice of psychiatry. Basically practicing psychiatry with a full understanding of the importance of sleep, and doing everything possible to optimize it, to restore the brain during the night for peak performance during the day. And I've been in private practice now since 2013, right in the heart of Silicon Valley. We work with some really intelligent, high-powered professional people from all walks of life, actually. And in all cases, whether they're high-functioning executives or just anybody for that matter, we all could benefit from a little bit of fine-tuning. And I think that the days that we live in, so much is demanded of us, and we're so far from the caves that we came from, that I do think any performance vehicle car is going to need fine-tuning to optimize performance, and that's the work that we enjoy doing here.
Excellent. So you work with both the brain and sleep. So how can our brains, or maybe our minds, impact our sleep?
So there's a very close relationship. I really feel that like the human mind, along with the sleeping part of it, it truly is like a yin and yang. Our minds do by night can impact what we feel during the day, and what we feel during the day can impact our sleep at night. So when it's good, it's great, but when it's bad, it's a vicious cycle that feeds on itself. People that don't sleep well are more prone to impulsivity. Their memory is worse. Their appetite can get dysregulated, and they can be carb craving during the day. And a lot of times, anxiety is just worse. I think for anybody that has a sleep disturbance or doesn't get enough sleep, impulsivity has so many dangerous manifestations. You know, it could be impulsively sending the wrong email, running a light, talking back to somebody when you shouldn't have. But even in more subtle versions, I think anxiety at its core is really an impulse control disorder. And there's a bit of impulsivity and depression as well. In anxiety, you know, it's like, don't think about pink elephants. Oh, but just one more time, right? So if people have sleep disturbance, they tend to be impulsive, which makes it harder to stop thinking about the annoying thing that you can't stop thinking about. And the same is true in depression. I think it's harder to fight the negative thoughts when you don't have the fortitude that good sleep allows for you to do that. And even there, I think getting through our daily lives and navigating our own feelings, you know, even coming back to holding our own place and being zen requires a certain amount of discipline, a certain amount of not jumping to an impulse, not jumping to some reaction. But having good sleep really enables that to be stronger. And in my practice, I've seen getting better sleep, optimizing both the quantity and the quality of it, really can manifest in like increased mental strength and even spiritual strength during the day. And that creates a positive cycle. And when people have easier days, then they have better nights. And the two so easily start to go together.
Wow, yeah, that makes sense.
They're related. It's a really close relationship, and each piece needs to be fine-tuned, but they do feed off of each other quite a bit.
And what happens then, like if our minds get out of control during the day, like we have a lot of stress in our lives, how does that impact our ability to
So
sleep better?
in my practice, I'll often say that it's as if people were designed to almost have like a switch, like a slider switch between sleep and wake. And what I see happens in a lot of people that I work with is that their anxiety and their activation is so high during the day that they can't stop at night. And that I literally feel like it's like the slider wheel is like turned in favor of wake. Anxiety, obsessive thoughts, like impulsive behavior. This is like the products of being too awake. And some people are so awake that it's almost as if their days squeeze out their nights, where it's like you're so on during the day that your brain can't stop at night. And that's the most readily available example I could think of where truly where people like they're so activated during the day that they can't sleep even when they're allowed to. A good piece of proof supporting that I often see, there's people that you ask them like, can you nap?
Right.
And what I often hear is people will say that they're tired but wired,
Yeah.
or they'll have this combination of like I'm exhausted but I can't sleep, or at night I wake up too early in the morning. Why can't I sleep 7 hours? I wake up after 5. And some people that can't fall asleep in the first place. And those are, to me, those examples where you're so on that you can't nap and you can't sleep, or you can't sleep enough. And that's part of that cycle that sets.
Right, absolutely. So, talking a little bit about insomnia, can you talk a little bit more about insomnia and sleep apnea, kind of the difference or how you know if you have sleep apnea, and then what impact that has, like the lack of sleep, what impact does that have on the brain?
That's a great question. And indeed, the one way to look at sleep is in terms of both quantity and quality. Those are two different things that kind of need to get divided. Insomnia tends to impact the quantity of sleep, if you think about it. And insomnia can be further broken down into trouble falling asleep, trouble in the middle of the night, or trouble waking up in the morning, or waking up too early in the morning. In sleep medicine, we call it initiation insomnia, middle insomnia, and terminal insomnia. So insomnia of any of those three varieties can basically reduce the total amount of sleep that people get. So insomnia affects the quantity of sleep. Then, as you mentioned, sleep apnea, those are things that can affect the quality of sleep. So sleeping is almost like going to the gym. You could go to the gym and sit on the bench for an hour, or you could get a really strong workout for an hour. And that's where it's good to get deep restorative sleep. Things like sleep apnea can fragment sleep. People with sleep apnea sometimes can wake up as much as like 30 times in an hour, and they don't even know that's happening. We see this on a sleep study. And they're waking up 30 times in an hour, and every time their brain tries to get into deep sleep, their brain is awoken. And that's the equivalent of like you going to the gym and every minute taking a break from your workout. At the end of that night of sleep or that workout, you just don't get the restorative, beneficial sort of sleep or exercise that your mind needs to restore itself at night. So sleep apnea is a very common issue. Typically what we see, people with sleep apnea, they'll report that they either wake up numerous times during the night or that they're really tired during the day. It's important to also make the distinction between being tired and being sleepy. People with sleep apnea can be both, but they generally also can be sleepy. We hear that quite often. Kids actually tend to not be sleepy so much. Kids actually tend to look like they have ADHD or hyperactivity when they don't get enough sleep. But adults, there's been patients that will fall asleep in the waiting room. And I've had people that I've worked with that have fallen asleep while driving. That's a marker of like true sleep deprivation, and sleep apnea can cause that by fragmenting sleep.
Mm-hmm.
Interestingly, in people with insomnia, that's less likely to happen. Those people are more tired than sleepy during the day. And that's why a lot of people with insomnia, which often goes with anxiety, can't take a nap even if allowed to. Whereas the person with sleep apnea, you leave them alone in a room for 10 minutes and they'll pass out.
Yeah.
But to just bring it back to the point, sleep apnea can affect sleep quality.
Right.
the depth of your sleep. And some things like insomnia or going to bed too late or poor sleep habits will affect the quantity of the sleep.
Sleep apnea seems to be getting more and more common, and a lot of times we hear about it being associated with like metabolic syndrome, but now you're talking about children who may have sleep apnea. So what's behind all that? Is there something else that we should be looking for?
So it's fascinating, and there are some. One of the neatest theories I've read was that our diets, which are now mainly processed foods and less legumy, chewy sort of things. A friend of mine who is a dentist up in Seattle, he really believes kids need to chew more, and adults perhaps as well. But it's really, until about the age of 13 or 14 that our jaws are kind of forming a lot. And during those times, I think it's important for kids to really get a lot of chewing action. The jaw may grow as we do that. And kids that tended to not eat as many, or kids that tended to eat more processed foods, softer foods, may have a tendency to develop smaller jaws. The other issue is allergies. Kids that have poor nasal breathing tend to be mouth breathers. Mouth breathing is not okay. Everybody kind of laughs that they have a friend or relative that's always mouth breathing. You could hear them breathing down your neck, but it's actually it's not good during the day, and it's definitely not good during the night. We were meant to breathe through our noses, and for whatever reason, maybe we have more allergies or more allergens these days. But allergies, especially in children, can cause mouth breathing. Mm-hmm. Mouth breathing, in turn, results in the tongue not being where it should be all day, and that also will affect the development of the jaw. And I think for anybody that has a small jaw, and if you do, or you look in the mirror, you might see that your teeth are crowded, or maybe you had teeth removed when you were younger. Those are all symptoms, not that your teeth are too big, but that your jaw is too small. And usually we'll tell patients that your tongue is rooted in the base of your jaw. And if your jaw is small, your tongue sits further back, right? And when your tongue sits further back, it has a greater likelihood of falling into your airway and blocking airflow, especially at night when people are sleeping.
Where is the tongue supposed to rest when we are not talking or eating?
I'm not an expert in this field, but from what I understand, there does need to be a little bit of forward pressure on the jaw, mm-hmm. and the tongue should actually be up against the hard palate or the soft palate up above. Yeah. But in some people, like if the tongue is too far back, it never the tongue is partly responsible for exerting some pressure on the jaw to move the jaw forward during development. Yeah. And that's why walking around with an open mouth doesn't achieve that. And that's why mouth breathing is not ideal.
Yeah. Oh, wow. So what are some things that can happen when you're sleep deprived over time? Like what happens in the brain? Is that behind any of the all the neurodegenerative issues that we have going on, or mental health issues?
So there's a lot of there's a really cool line of research that discovered what's called the glymphatic system, mm-hmm. which your brain basically does like a power wash in deep sleep at night, which removes a lot of toxins and a lot of the metabolic byproducts that are produced during the day. So your brain in deep sleep gets a pretty massive power wash. And some people, there is evidence actually that the same enzymes that we see in Alzheimer's and the same proteins that we see in Alzheimer's build up in people even after a night or two of not sleeping. And that's why actually in the elderly population, sleep is even more important, because for them, it can affect neurodegenerative diseases, and it can also improve brain longevity. And that comes back to that question of sleep quality. Besides the metabolic byproducts that build up in the brain, because it is one of the most metabolically active organs in the body. That's why, if you think about it, your heart doesn't even take a break for 8 hours to clean up, right? But your brain needs an 8-hour pause to clean up after the party. Mm-hmm. What we often see though, besides the metabolic stuff, is that people that are sleep deprived, it's almost as if so our brains essentially have the more reptilian brain, right? The emotional systems and all the fundamental stuff about feelings, and a very, very important part of the brain. But then you also have the prefrontal cortex, and that's the thinking part of the brain. And people that are sleep deprived, it's almost as if the cortex isn't as active. Yeah. And that's why you're more prone to impulse. You're more prone to binge on carbs. You're more prone to, say something you shouldn't have said. And that all happens because the part of your brain that formed last in evolution, isn't fully operational because it didn't get to fully recharge at night.
Okay.
And we
Wow.
do see, by the way, weight gain is another big issue, by the way.
Okay.
Mice that are sleep deprived tend to eat more. Besides elevations in enzymes like ghrelin, which is a hunger promoting hormone, we also see elevations in cortisol, elevations in insulin, elevations in blood sugar. And that's how your body responds to stress. And that's how your body responds to sleep deprivation.
Wow. So people are having issues losing weight and they know they're not sleeping well. That could be a cause to look at.
Because the body goes into kind of a panic overdrive. We need adrenaline to get through the day. And that causes metabolic effects. I often see people with trouble losing weight also.
Wow. Interesting. So if someone is struggling with sleep and they're not really sure, that it might be insomnia, but they feel like they're waking up throughout the night, where do you even start?
So if someone's I start by looking at the day. You know what I mean? You kind of want to get a sense for how anxious, how is your day, right? Like, is there anxiety throughout the day? Are you impulsive? Are you reactive? Can you turn your mind off? Right? That's a very important thing for people to be able to grasp, because if you can't stop your mind for 2 minutes online at the supermarket, instead of grabbing your phone and immediately checking email and text messages and so on, it's hard to turn your brain off at night. And that really does come back to that slider switch between sleep and wake. I think I would start with a patient by looking at, how active, how awake are they during the day? And some people you might realize are too much. You don't need to be texting, calling, emailing at every second of the day. And some people are hyper productive. And that's okay, but that does not lead to good sleep at night. So yeah, we definitely start by looking at just like how active people are during the day. And then we'll look at things like sleep habits, sleep hygiene, how regular your bed and wake time hours are, and what you do when you can't sleep. And the other thing that really helps people with insomnia, I think, is really just like any practice of meditation is really useful. I tell everybody, you got to practice driving in the parking lot before you drive on the highway.
Yeah.
And if you're trying to meditate yourself to sleep at 3 a.m. before a big meeting, good luck.
Yeah.
Ideally, people have had that practice before.
Mm-hmm.
And that's where I think a meditation practice is pretty essential to getting good sleep.
Do you have one that you recommend, or like an app, or what do you?
I think it's best to keep it simple.
Okay.
And I think we should all remember that really the goal of meditation is just presence. And it's okay to have random squirrely thoughts. We all do. But can you come back to your breath? And you can repeat that as long as needed. I do for about 10 minutes a day. Some people can go longer. But I think it's important to try to keep it sustainable. You want to find an amount. You want to set a goal that you can keep. And I think everybody that decides that you're going to meditate for an hour a day every day falls off the wagon pretty easily.
Yeah, right. Exactly.
But meditation, at the end of the day, it doesn't need to be an app, and it doesn't really need to be complicated. I don't think you even need to sit in any specific position. I think literally it's the exercise of like just watching your own mind, watching your breath actually. And as soon as anything deviates from that, which is normal, it doesn't mean you failed. The true test is like how easily you can come back to your breath.
Okay.
And repeating that time and time again, I think is a wonderful skill to have. And that also helps people sleep at night. Because I think to be able to fall asleep at night, you need to know how to turn it off.
Absolutely. Almost like a brain rewiring type of practice then.
Yeah.
You have it. So at your practice, you go beyond just recovery of the brain and sleep, and then work on performance. So what does that mean? And then what are some of the ways that you help people to improve their performance?
So I think it's important to look at people from, I see people as onions. I think the line was from Shrek, but people as onions, you kind of got, there's like at the very core of everyone is your biology, right? Then is your psychology, which is around that. And then is your social setting, right? So it's like biopsychosocial. This is a model that we use in psychiatry, which very accurately describes the different layers of things. So my approach to performance optimization is, number one, always focus on the core, right? Which definitely is like biological things. Let's make sure that you're not having, heartburn as you sit there in couples counseling, right? Or let's make sure that you don't have restless legs that are keeping you awake at night.
Mm-hmm.
So definitely need to dial in the biology because that's at the core of everything. The next layer that then becomes is like, psychology, right? The psychology there is now knowing yourself, knowing your strengths and weaknesses, right? Like just having better awareness of what you're good at and what you're not good at. And also for me, in my work in improving people's performance, I almost see it as like we're going on a safari and we're going to take pictures. And I, as your psychiatrist or your sleep doctor, my job is to provide you a good album of like, this was you at a high, this was you at a low. And do you remember that you did really well in this situation and not so well in another?
Okay.
The other thing that I think has been huge that I've used is like the 80-20 principle. I help so many patients learn when to say no to themselves, when to say no to those around them. I think it's very important. Part of knowing yourself and optimizing your performance is knowing the things you shouldn't do and when to stop.
Right.
And then, looking at just like, on the social level, there's, optimizing relationships with children, parents, colleagues at work. For a lot of people, there's a benefit to setting an intention and setting goals. We do vision boards with some patients and just kind of having like a roadmap and somebody to guide you through it. I often see that there'll often be a life coach, a therapist, a psychiatrist involved. Maybe it's my own obsessiveness, but it's kind of nice to also do it all in one place.
Mm-hmm.
And that is the same thing that we're doing with sleep and psych, where I think by having an awareness of all the pieces, you can actually get the best possible outcomes. And further along the levels of, the line of performance optimization, I think is spirituality. I think we all benefit from knowing that there might be something greater than ourselves and bringing that into our lives. And as I joke with some of my patients, I say, if you think you're the top of the food pyramid, the only way left is down.
Oh no, right.
And that's where I'm not preaching God here, but I am saying it's good to believe in something that might be greater than we are.
And how do you coach people along those lines?
That depends on the person. You know what I mean? Everyone's situation may be different.
Okay.
It depends what their issue is, but there's not everybody needs like to know about spirituality, for example.
Okay.
And not everybody needs 80-20 sort of, learning to say no philosophy.
Okay.
But it depends what the active issue is.
Makes sense. Yeah.
But at the core of that, I should say, again, we come back to, biology. That's also so important, you know what I mean? And then your own psychology. I think it's important to really address things in layers and make sure that at the core you're dialed in and not having heartburn during a meeting.
Mm-hmm.
Or tired on your way to work.
So in that case, you're working with diet then to improve that?
Yeah, so we do diet. We use supplements. We look at exercise patterns. We also look at circadian factors when people, what their natural circadian rhythms are, how to use daylight and darkness to enhance circadian rhythms, but also looking at performance and timing presentations and work tasks to when is your optimal time of the day to do that.
Okay, great. So is there anything else you want to add along those lines?
Well, I think that on those lines, that's it. Yeah.
All right. Yeah. So what do you do personally on a regular basis to fortify your brain?
So for me, I think for like on a daily basis, I run most days of the week.
Mm-hmm.
I think exercise is something that just is of tremendous value. And I encourage all my patients also. I say, like, if you didn't break a sweat doing it, you probably should push it a little more, And there's so much data that like just, especially for older people, we can really learn a lot. Exercise, diet, and social duties keep us alive, happy, and healthy late into life. There's a great series of papers about blue zones, which looked at places on Earth where people live long, happy, healthy lives. And there's like a lot of centenarians or the people that live to be 100. In all those places, like the common factors that emerged were really like diet, exercise, and belonging.
Yeah.
So taking that, applying that to my life and my patients' lives, taking care of like exercise, obviously running, swimming, whatever you can think of is great. Diet, yeah, the Mediterranean diet keeps winning hands down. The more fish you eat, the better. Omega-3 does not hurt. You could take a lot of it and be okay. And then a sense of purpose. Obviously, I think we all go through different stages of life, and there's times when work is completely consuming. And I think for older people, they retire, and then what do? So for them, it's important to find something to do. But I think for the majority of people between their 20s and 50s that are working a lot, I think it's equally important to find downtime and play. I think it's important for all of us to sort of remain children at heart and keep that novelty. That if you think about the Zen mind, beginner's mind, is actually how a child sees a room. You know what I mean?
Yeah.
Children could get lost staring at, wow, like that's such a shiny ring, and we've all become jaded and we don't pay attention to that anymore. It's like, oh, I'm in a hurry, I gotta go. And anything
Right.
that slows us down and lets us be children and lets us have fun, and see the world through like novel, unjaded eyes, I think is a source of happiness and a source of strength that can make your work actually better as well.
Absolutely. Yeah, go find a sunset.
So
Right.
I work hard, play hard, run, and eat fish.
Yes,
Is the answer.
yes, that sums it up. All right. Was there anything else you wanted to add?
I think that's it.
Okay. So where can people go to find out more about you and what you do?
Sure. So on the internet, www.siliconpsych.com. If you Google Alex Dimitriu, I've had a lot of blog posts, publications, and commentary. My last name is spelled Dimitriu. Again, if you go on the website, we'll have links to all of that as well. And that's siliconpsych.com.
All right. Thank you so much for your time and
Absolutely,
all your
Betsy. Thank you so much, and appreciate you doing this. And it's such an amazing field, and I'm happy that there's this level of curiosity about something so important.
Yes.
Thanks for doing what you do.
Thank you. Take care.
Thank you so much.